CTM TV continues our conversation at ARTeC 2015 with Dr. Matthew Smuck, the Associate Professor and the Chief of Physical Medicine and Rehabilitation, as well as the Medical Director for Rehabilitation Services at Stanford University Medical Center. Now, it is, of course, from that introduction, Dr. Smuck is a very qualified person to tell us about the topics of his presentation here at ARTeC 2015. So, thank you for joining us, and do tell us the topics of your presentation.
I'm happy to be here. The topics of presentation today are on spine intervention, and this is discussing things that we do to the spine, typically through needles, injecting medications to diagnose the source of a person's spine pain, and inserting medications and other treatments in order to make back pain better. And so today we're talking about diagnosis through imaging, through physical exam, and then specific use cases where we would use needles and injections to help somebody with back pain.
How important would you say is rehabilitative medicine as a sector of medicine, and are there many new technologies or methodologies or modalities of treatment coming up in this particular area?
I would say rehabilitation is, in my opinion, the most important aspect of treatment for back problems. We know that only about 10% of back problems can be treated surgically, and that means the majority of people with back problems need rehabilitation care, not surgical care or other care. And so when failing to improve with the typical over-the-counter medicines and anti-inflammatories, it's really the rehabilitation specialists that offer the most options and the best treatment for the majority of people with back problems.
And what is the important segregation between area non-specific treatment, such as therapies, and also target-specific treatments like injections? So which one is more important, actually?
Well, most physicians will like to start with treatments that are less invasive and thus carry lower risk. And some patients with non-specific problems can't be treated with something specific like an injection. So the best answer to the question is that not everyone is a candidate for treatment with specific injections, and identifying those people who are and providing those treatments when the non-specific treatments fail is the approach that we advocate.
And the final question, in the interest of the professions in this particular sector, would be how much recognition should be accorded to professionals such as physiotherapists? And do you think that enough recognition has been accorded to such professions within the Southeast Asian region?
Well, I wish I could speak to the way care is delivered in the Southeast region. To the best of my knowledge, it's similar to the way we do things in the United States, and that is that the physiotherapists work as a team alongside the physicians to deliver the best care to the patients. And there's a lot of new ways of moving forward with those types of treatments in the United States right now. Consideration of direct access to therapists and other treatments, and a lot of thoughts about the pros and cons of those different approaches. But any rehabilitation professional in the United States would say, as I'm going to say, that the therapists that provide the treatment of our patients are very important to the outcomes and the improvements in our patients, and very important part of the team, but not understate their value.
Thank you very much for your insights and for joining us on CTM TV and MyMedicNews.com. We have been speaking with Dr. Matthew Smuck, the Associate Professor as well as the Chief of Physical Medicine and Rehabilitation and the Medical Director for Rehabilitation Services at Stanford University Medical Center. You've met Nicholas Pang at ARTeC 2015, Bangkok, Thailand.